Hello, and welcome to Network Commons, the Build Healthy Places Network's live discussion series on cross-sector strategies to improve neighborhood health and well-being. I'm Jeni Miller, Senior Research Associate at the network, and I'll be serving as your moderator. Today we will learn about 4 innovative projects where community developers integrated health into local revitalization efforts. We're lucky to have the project leads here today to share their firsthand experiences collaborating across sectors and the practical tips for our audience. You can read more about our speakers by clicking on the link in your chat box, but here's a brief overview. Romi Hall is Healthy Neighborhoods Manager for the East Bay Asian Local Development Corporation, otherwise known as EBALDC. She will share about the organization's Healthy Neighborhoods Partnership in West Oakland, called the San Pablo Area Revitalization Collaborative, or SPARC, a comprehensive community development initiative integrating housing, economy, community, and health to revitalize one of Oakland's most disadvantaged neighborhoods. J.T. Hannan is the Director of Public and Governmental Affairs at the Bayou District Foundation. He will discuss his role in the Columbia Park development in New Orleans, a post-Katrina rebuilding effort with early childhood education as a focal point for improving neighborhood health and well-being. Maureen Hansberry is the Real Estate Portfolio Manager of Children's Hospital of Philadelphia, also called CHOP. She will discuss the hospital's Community Health and Literacy Complex in South Philadelphia, a multifunctional hub currently being developed in collaboration with the City of Philadelphia. And finally, Mary Wheeler is a Program Officer at the Twin Cities Local Initiatives Support Corporation, or LISC, and she will share her experiences working on the Rolling Hills Apartments, a comprehensive apartment renovation to support refugee and new immigrant families in St. Paul, Minnesota. I've written about all 4 of these projects in detail as part of the network's community close-up series at buildhealthyplaces.org. But today, we'll kick off the discussion with brief summaries from our speakers. Then we'll move right into questions from our audience. On that note, thank you again to those of you who submitted questions prior to the event. We've gotten a lot of great questions. Please continue to share your questions and comments using the chat box on the side of your screen or via Twitter using #NetworkCommons. So let's start with you, Romi. Can you share a bit more about the San Pablo Corridor project and how you collaborated across sectors?
Sure. Thanks, Jeni. Good morning, everybody. As Jeni said, my name is Romi Hall, and I'm the Healthy Neighborhoods Manager here at the East Bay Asian Local Development Corporation, EBALDC, and we are a affordable housing and community developer throughout the East Bay region. In my role as backbone staff to the San Pablo Area Revitalization Collaborative, we started in 2014, and we have 14 core partners. We're focused on 3 neighborhoods in West Oakland, and we are really cross-sector, multi-sector, and working. These 14 core partners include resident associations, neighborhood-based community-based organizations, institutions like the County Public Health Department, the City of Oakland, the Federal Reserve Bank of San Francisco, and healthcare, including a hospital system and also a federally qualified healthcare center. We've been working together for almost 2 years, and in the first year we have come together, and our frame of what brings us together is the social determinants of health, and our methodology that we're using, which is very popular, but collective impact. And so together, these 14 partners, we spent time looking at community data, hearing community voice, and we've come up with an action plan that we are already 1 year into implementation that's focusing on the production of affordable housing and the preservation of naturally occurring affordable housing. We're also looking at economy, connecting folks to jobs. Also, we are located on a business district, so we're looking at building economic development through co-ops and micro enterprises, as well as looking at anchor institutions and businesses. We're also doing a big blight campaign and beautification work, and really tying this all together and really building up community power. So part of the comprehensiveness of our initiative is that our partners are really diverse and coming across these different sectors of upstream social determinants of health, and recruiting their partners and other organizations and residents to align together to really make health in the neighborhood happen in this neighborhood that we're working in West Oakland.
Fantastic. Well, thanks so much, Romi, for that introduction. JT, how about you? Tell us more about Columbia Park and how Bayou District Foundation served as a community quarterback for the project.
Thanks, Jenny. Good afternoon, I guess, from New Orleans. We're ready to start Mardi Gras this weekend, so everything's very exciting down here. Bayou District started basically right after Hurricane Katrina, with Katrina obviously wiped out 80% of the city of New Orleans and caused untold damage and loss of life. But right after the storm, we were contacted by the Eastlake Foundation in Atlanta, Georgia, and the message really from them was, if you can replicate the work that we've done in terms of community revitalization in New Orleans, you won't just restore a few blocks of New Orleans, you'll restore a wide swath of the city in one fell swoop. And so we really then formed a nonprofit foundation, 501c3, and then partnered with the Housing Authority of New Orleans, with HUD, and with a variety of educational partners to create what we think is one of the finest place-based redevelopments in the country. And that was done at the former St. Bernard housing development, which is a very dense, very poverty-stricken, and very violent part of New Orleans. And so this is the 10th anniversary, really, of Bayou District this year. We have created 685 mixed-income apartments. We've created a $9 million early education center, EduCare of New Orleans. That's the beginning of a Cradle to College pipeline that's in the center of this community. We've restored the street grid. We've built playgrounds. We've built playfields, a community garden, and we have plans to build a grocery store, a pharmacy, championship golf complex to finance this, which is kind of the Eastlake model. And things are really starting to happen in a very big way, to the extent that now 56 U.S. cities have visited us here in New Orleans to see the work that we've done. So we're very excited by the progress that we've made, and we're really hopeful about the next few years in terms of our progress.
Fantastic. That's really exciting, JT. So Maureen, how did CHOP's partnership with the City of Philadelphia come about? And what's the current status of the Community Health and Literacy Complex that you guys are working on together?
So, the City of Philadelphia really had a need to improve their health center too, the recreation center, and their library. It sat on the city block and about maybe 2 blocks from CHOP, South Philadelphia Primary Care Office. And we had a need to move our office because it just was too small and couldn't really service our patients any longer. So the two parties started talking in December of 2012, and the partnership was born. So what we did was we started with meetings between all of the parties, brought together leaders from the city, from the health center, from the library, the rec center, and from CHOP to really talk about things like remediation and demolition, project schedule, building design, legal agreements, post-construction operations, really a gamut of topics. And what we did is we had monthly meetings, and we took a top 10 list that we decided we would deal with at every meeting, and the commitment was there to really make that happen and advance the project forward. Another important partner in this process for us was really the city's South Philadelphia community. We brought the community into our project in 2 really important ways. The first was we were looking at the actual development of the project, and we went to the community before we went to the approvals process and asked them what they really wanted. And through that process, we made some impactful changes to the Health and Literacy Center. Another important way we brought them in was through our construction process. We talked to them about things like, is the development clean? Is there parking issues? So we really wanted to get their voice and deal with anything that came up before it became a problem. And we were very successful in doing that. And we still have those conferences with them today to make sure that everybody's on the same page and there's no issues. So the current status of the project is pretty exciting. We are opening in April, and we will have site work is being completed right now. We are going to start our furniture and equipment placement in March. Original ceilings are being put in. But really, what all that is just the building. What's going to happen inside is really much more dramatic. The city will be able to have expanded services as well as CHOP. The library is going to be able to service about 35,000 additional patrons per year. The city and CHOP medical practices will be able to increase patient visits by about 25,000, and the rec center will have about 5,000 users per year. So those benefits individually are really impressive, but beyond that, we're going to have a shared programming committee that will have activities that we will all participate in. So the first of those is planned for the fall of 2016, and it's going to focus on health and fitness. So we'll have individual suites, we'll have things going on in there, and then we'll also have shared activities in our common areas. So we really have a lot to look forward to with this project.
Fantastic. Well, I know the Community Health and Literacy Center and the partnership between CHOP and the City of Philadelphia is really innovative. So finally, Mary, tell us about the Rolling Hills Apartments and your role in coordinating between the various partners involved in that project.
Hello, my name is Mary Wheeler, and I'm with Twin Cities LISC. And briefly about our organization, we're a national organization and with about 30 offices across the United States. And Twin Cities is a local organization, and our services span both Minneapolis and St. Paul. And about 3 years ago, our organization was really looking at the intersection of health and wellness and community development. So how does the physical environment really support or detract from an individual's health, especially with those individuals that our organization's mission is to partner with and support, which is low income, of color, and in this case, for this particular project, refugees and immigrants. So Rolling Hills Apartment Complex is located on East Side St. Paul, and it is in an area that is heavily, there's safety issues, housing retention issues, and it's a 5-complex building spanning a block, give or take. And what we did is we were a part of an investment process to renovate the facilities, and then as a part of that, we sort of sat back and said, if we're really going to look at the development of this and really to support the residents who speak many different languages and come from many different communities, how can we support them in a different way than we have done with other projects? And it just so happened that core partners such as Lutheran Social Services, whom we work with already, Eastside Family Clinic, we had worked with them and invested in new market tax credits for a new building, came together and said, how about we take a look at creating sort of a new effort that looks at engaging residents to discover how we can do things differently within our organizations to better support health and wellness, but more importantly, how do we really support the asset? How can we look at the assets versus the deficits of what's happening in this community and look at the communities to sort of lead what programs, services, and what they can do to help each other. So over a 2-year process, a year process that continues, we invested a small amount of money, just a $65,000 grant to allow the group to do heavy resident engagement process, and they engaged up to 70% of the population. Today, you have resident-led large gardens where residents individually sort of share their cultural foods and they share recipes for cooking. But most significantly, as a part of the development, we had a program building added, and within that program building had sort of what they called an exam room. They didn't know what else to call it at the time. And that exam room would give life to Eastside Family Clinic's presence in this particular community where folks do not frequent the local healthcare system. So my role in that was to just nurture the partnerships, let individuals do what they know, share some of our models of collective leadership, and I've got to be honest too, because there's no one way that this could take place just with me from my organization. You know, really our national organization was involved as well with the grant administration, and I have a partner here that also worked with some social services and others. So today, we haven't had a chance to measure it yet, but there's on-site health-related activities. Residents are engaged and helping each other. Safety is significantly improved, and when we talk to residents and bring folks through, you know, just do sort of focus groups, residents actually just talk about how they have leadership in their own community now. They're managing their own health, and they're really enamored, thankful, respectful of the role that Eastside Family Clinic has played in bringing culture to health, so their individual culture could be witnessed in their health services.
That's really fantastic, Mary. And you know, I felt very fortunate to get to learn about all of your projects. And one of the things that's really some of the things that are sort of striking that these projects that your projects have in common, in addition to all of them involving a lot of collaboration and cross-sectoral partnerships and bringing a number of partners on board, they're also all firmly place-based, so that you know, there seems to be something really important about bringing together, whether it's services, whether it's community, whether it's partnerships, whether it's new construction, but locating it in a place and making that place kind of become vibrant. And then the other really striking thing that all of your projects share that stands out to me is you're all addressing multiple social determinants of health. So those core factors that underpin people's ability to be healthy, including housing and access to food and community connection and education, and all of those things are just so critical to supporting people's ability to be healthy.
Right.
So these are really exciting projects. It also strikes me that some of the origins of your projects they come out of opportunities. Different kinds of opportunities emerged, and then a group of partners or whatnot seized upon those opportunities. So I think all of those are really interesting facets of your projects. So we want to have a chance to get some audience questions going, and we've gotten a lot of great questions both before the event and coming in now as we're live. So why don't I just start out with a question that came in from a variety of different folks, and the question is, what were your strategies for engaging community members in the planning and development process? And how did you build trust among the partners involved? And I'd actually love to hear from each of the speakers about this. I know some of you spoke a bit about this already. So I think, JT, you didn't dive into this issue as much, so why don't we start with you, and then we can go to each one of you and get a little bit more thoughts about how you engaged community and then how you built trust with your partners.
Well, obviously it was a very unsettled situation in New Orleans when we started our work because everybody was very much displaced, and then add to that the fact that the public housing development that we had worked on had fallen into such disrepair that only 960 of the 1,380 apartment units were livable or were lived in at the time of the storm. So there was a lot of distrust between, frankly, the housing authority and their residents. And then when we came into the picture, it was like, oh, you know, another great plan to help improve this situation. And so we had 40 focus groups, you know, over the course of a year and a half, with the former residents and with the neighborhood that we were working in, to kind of continually just lay out the plan, lay out the vision, ask for input, So personally, I really didn't want to create a situation where it was like, here's the plan, what do you think of it? It's much more of like, how would you guys do it if you had these resources, and on and on and on. So basically providing a framework, but allowing the community to kind of fill in the blanks where we didn't have a good structure. And then two, we spent some money doing this, but we flew some of the residents to Eastlake to see an example of what we were proposing. And I think Eastlake is a community that it's hard to believe it exists until you actually walk through it and have seen the difference between what was there and what was there and what is currently there. So that was a huge step. And we also brought some elected officials and some of the ministers and several of the real stakeholders in the community on that trip. And there was definitely some fits and starts as we got rolling, but I think that those steps kind of helped alleviate a lot of the tension that surrounded our work.
Great. Romi, let's turn to you. You mentioned a bit about how EBALDC and the partners are involved with the community, and the community is involved with Spark. Can you talk a bit more about that?
Sure. Excuse me. I think in a lot of this work that we're doing, there's been groups that have come before and said that they were going to do things and they didn't do things, and so there's a lot of apathy, not just on the part of residents, but also on the part of partner organizations. Can we really do this? Can we really do this? And so I think one of the things that really helped EBALDC, we had in our strategic plan around creating healthy neighborhoods. And really believing that residents and multi-sector partnerships across all these different sectors had to come together and work together. But in part of setting that table, and we were lucky to receive a Partners in Progress grant from the City Foundation and the Low Income Investment Fund to really support the backbone of the work and to be a community quarterback in bringing all of these different partners together and providing a neutral table for folks to come together and talk. And we actually had a neutral facilitator, so there's not a co-chair or any chair of our overarching steering committee, and that gives everybody an equal vote and say. And then the backbone, in my role, I can really help support the work group and partners, and that was a really big trust building factor. I would say it's still taking time. We've been, as a collaborative, have been a year. Part of our strategy has been implementing small wins and making wins visible for residents to see and say, oh, they're doing something different. They need business. This isn't just planning. They're implementing. They're moving. So that's been a big part of our strategy as well. And with that, we've been able to really work with 2 resident associations who are also a part of our steering committee and really working to align their work with our collective larger frame. So it's taken a lot of work, a lot of trust building, a lot of conversations, but we're at the point now where we're seeing more residents are activating, and we're only 2 years in. So that's been part of our strategy of really thinking about building out small wins, making it visible, holding partners accountable, creating a neutral table for folks to really be able to participate and vote and to vote and have their say in what's happening in their neighborhood, and also really thinking strategically about supporting a backbone function to help the work get done.
That's great. Maureen, could you talk a little bit about, I know the process of partnering with the city was complex. Could you talk about building trust with your partners there? And then also, you mentioned that some of the community input into the project early on shaped how the project rolled out. Could you talk a little bit about those aspects of engagement and building partnership?
Sure. This was interesting because it was a new endeavor for both CHOP and the city. Neither of us had ever done such a huge public-private partnership. So it was really a pioneering opportunity for everybody. What we followed really 2 fundamental principles, and one was organization that I touched on a little bit earlier, when we created this steering committee that we had, there were, SVPs and managers and directors from all parts of CHOP and all parts of the city that really were asked for their input. So when we were talking about, how big the city space was, or how big the CHOP space was, or how many parking spaces everybody got, it really was a collaborative effort. And it was really important when we had our steering committee meetings that we truly made an effort to come to agreement or move forward all of our top 10 issues for that month. Because you can spend so much time just talking and talking and talking. But for us, it was very important to move our issues along so we get to the end result. And really what was important for us was to be able to serve our diverse South Philadelphia community. So that's what really kept everybody in line, is that we knew that we weren't working towards who got how much square footage. It was really how we serve our constituents. And I think the next important part of it is to be flexible. Again, we had never done this before. The city had never done this before. So CHOP as a developer was, hiring the CM and managing the process. We had to take a lot of input from the city and really work with their processes and their tasks and their rules and their operating guidelines. It really had to keep it moving. And CHOP we have our own rules and our operating guidelines. So we had to really incorporate all those things. And it was that regular dialogue that really kept everything moving. And again, the end goal of serving the community was really what we were getting towards. So going back to your question about the community, Philadelphia has multiple RCOs, recognized community organizations, that are actually residents that sit on community organizations that make decisions about what happens in their community. So when CHOP is a project in the city, not just with Schuylkill Avenue, but with not with South Philadelphia, but with Schuylkill Avenue that we're also working on, we bring in those RCOs and we get their input. So when we started this with South Philadelphia, we brought them all together and we made changes on the building entrance because they thought it should face the street and not this street. We added a spray garden. We added half of a basketball court to really make sure that they were getting the primacy what they wanted out of this project. Because that's really what we were doing it for. We weren't doing it for CHOP. We weren't doing it for the city. We were doing it for the residents of South Philadelphia.
Fantastic. So Mary, a couple of the things that were striking when you were talking about community engagement and input into the work at Rolling Hills are the level of engagement and the diversity, language and cultural diversity of the folks that you're working with. Can you talk a little bit more about the challenges and then how you managed to get that high a level of involvement?
It's interesting. Things sometimes just don't feel like a challenge when you're in the moment and you see the look on people's faces who have not been heard or have not been engaged or find day-to-day life difficult because English as a second language really impedes their ability to sort of move through space. So the challenges that we faced were really sort of the things that also gave us were very inspiring. We did need to place quite a bit of money into translation, and meetings would take a very long time because in some cases we need to translate into 5 or 6 different languages where residents didn't speak a particular language, English, and could translate. So that took a lot of time, but also gave space for residents to actually be together, spend time together, whether those meetings always had food, and just smile and know each other and feel safety in that. So I want to backtrack a little bit and talk about sort of the readiness of the project. Some things you mentioned, Jenny, that like all the stars were aligning just right, and it sounds like other projects that we're talking about have this factor as well. Because we were supporting a renovation project, residents were a little frustrated because renovation is hard, but we were on the sort of on the tail end of some of the renovation, and residents were beginning to see how their community, how we invested, listened to what they wanted, what was important to them, and really took care of their home. Mm-hmm. And there was, with that came a certain amount of readiness and openness, I think, even when you sort of look at the different languages that were spoke. And then secondly, West Side Family Clinic, East Side Family Clinic, long story made short, the broader organization that we worked with, the healthcare provider, was West Side Family Services. They had a group that's called Salamo, and Salamo is a community-based research group that has had a lot of experience already on the East Side and had sort of indoctrinated themselves already to this particular community, but to ethnic groups that were present in this particular community. So what they did then is they went ahead and they identified ways to, at each building, have resident leaders reach out to other residents about meetings, about informing them about what was going on, the value of coming together to make their place safer, share resources, thoughts, and the willingness of the owners and the healthcare provider and others to come around and really listen and support their wants and needs. Mm-hmm. And I think it's slow up front because you need to sort of weave these relationships and this openness to kind of bring it. But once it got together, residents came out in numbers to share what they wanted for their particular community, or to even share assets that they had, like car repair, daycare, that they could kind of sort of barter and help their community be safer and help them know each other in a unique way and lean on each other to help their economy.
Terrific. That's terrific. All right, let me get another question in here. We have a question live from the chat from Ellen Ton, and her question is, how are sites tracking health changes and outcomes, and what is being measured? And I'd like to start to direct this question to JT, and then we'll see if others would like to add to that. But JT, how is your site tracking health changes and outcomes, and what's being measured?
Well, initially we realized that we didn't really have a good delivery vehicle for healthcare in the area. So the first step was really to get an FQHC, a federally qualified health clinic, on site in some capacity so that we could start addressing the issues. And then as a parallel, we really wanted to establish a cradle to college education system. So that's where the partnership with Educare came in, and we built that school. And so in terms of measurement, essentially we're trying to develop a metric that is really showing, are people's lives improving in terms of employment, in terms of their household income, in terms of their health outcomes. I mean, the area that we're dealing with had a lot of endemic illnesses to low-income populations. And so, are less people now suffering from diabetes? Are less people now suffering from, heart arrhythmias and those type of things? Are children who are leaving Educare at the age of 5 more prepared for kindergarten than they would be if they hadn't been in the system? The answer to that's an overwhelming yes, by the way. And so those are the two things that we're really focusing on, and it is a process. So we're starting to get more healthcare partners in. We're talking to LSU, and a new high school was just built across the street that has a medical clinic, so we're trying to see what type of impacts we have on that population as well. So there's a lot of things that have kind of evolved, but in many ways I think that we're kind of a great laboratory for building healthy places and building in health outcomes. Some of that was unwitting, but when you combine the fact that we're doing cradle to college education, very robust recreational and outdoors program, we're trying to build like a healthy grocery outlet where one does not exist currently, and then add to that, great housing and great transportation. We think that we should be able to measure an extended life expectancy for our population it's much greater than it was prior to the storm.
Yeah. Well, and we know that New Orleans does have some pretty great disparities in place-based disparities in life expectancy. So that'll be interesting to see how that rolls out over time. Would anybody else like to add something about measuring health and measuring health outcomes?
This is Romi. I think what's also important here is that thinking of health beyond healthcare and really thinking about on a bigger scale, more upstream around other health determinants and factors. So we're looking at, as part of our Spark Collaborative, we do have a specific focus on addressing high blood pressure, and we're working with both an FQHC and our hospital healthcare system partner to see if there's a way that we can link if there's a reduction in ER and hospitalization. So we are having a specific focus, but we also recognize that health takes a long time to make improvements, and so to that end, we are also considering, as part of our health outcomes, how does the business economy change in the neighborhood? Are folks connected to jobs? Is there community ownership? Are residents leading these processes? So this is also a part of our metric system and looking at how we're creating a healthy community. Are people able to stay in the neighborhood and afford their housing? So all these things are what also create a healthy neighborhood, and will impact those health diseases like high blood pressure and seeing reductions, or diabetes and those kinds of things. So it also really thinking about health and health outcomes beyond maybe the healthcare realm, and thinking about education and early childhood, and all those things are important factors in measuring and tracking as well.
Fantastic, and it'll be really interesting to to learn over time the kinds of metrics that you develop for measuring the things that you're talking about. So let me get in another audience question here, and this one again came in from various folks. The question is, what strategies did you use to help different sectors build a common language and unite around the common agendas? What messages or techniques have you found successful in convincing healthcare organizations to really go upstream to address and invest in social determinants of health? Let's start with you, Romi, on this one, and then we'll see if others want to add in on something.
I think the word, that opportunity, it was the right time, right place, right opportunity, and I think with the Affordable Care Act, a lot of hospital and healthcare systems are really looking at where are their drivers of health, and so one of the healthcare organization we work with, Sutter Health, they've been looking across their system to see where are the most vulnerable communities, and they found in West Oakland and in East Oakland, another neighborhood, are one of the two neighborhoods that are the biggest drivers of ER and hospitalization or hospital visits within their hospital system. And so we were actually introduced to Sutter through one of our partners, an FQHC partner, Lifelong Medical Care, who made that connection, and we really just had an initial conversation of thinking about those upstream factors and how we can work together. And I think the hospital system could see that we were already bringing partners together, aligning the work together, and they had a place to also fit in to help support this work. So that was a lot of conversation, and we were actually able to translate and move those conversations in a more formalized way, where we applied for the National Build Health Grant, National Build Health Grant Challenge, and we were able to secure the grant with Sutter Health, our implementation grant to support our Spark work, along with the public health department, and it's really beginning robust conversations. But it was right time, right opportunity. That healthcare system was open to this larger social determinants of health frame, and we were introduced by a partner, and we've been working together since on understanding their language as well as understanding our language as well.
And Maureen, definitely want to get your perspective in on this question. You're coming from a healthcare system. What led CHOP to start looking more upstream and working in ways that are, helping to build a library and a recreation center? What what was driving CHOP's thinking around that?
Well, I think it goes back to what I talked about earlier, was really the need. So CHOP had to find somewhere to land our new practice, and it made sense at that point in time to really look at the community and say, okay, how can we benefit the community in the best way possible? And that's what really helped this partnership solidify. We had two champions. It was then Mayor Michael Nutter and then CHOP CEO Stephen Altschuler, who really were the drivers behind wanting to improve health outcomes for the city of Philadelphia, for the residents of the South Philadelphia community. So that's really what brought it all together.
Fantastic. Okay, unfortunately, we're getting close to time, so this is going to be our last audience question. And this comes from Allison Moore, who's a master's student in city planning at UC Berkeley. And this is a question from Mary. How did you negotiate a solution when organizations or residents had incompatible visions? Was there a consistent building process? What tools or insight do you wish you had had during development of your project?
You know, you went out during part of that question. Can you repeat it, please? I'm sorry.
Sure. How did you negotiate a solution when organizations or residents had incompatible visions? Was there a consensus building process? What tools or insight do you wish you had during development of your project?
Sure, sure. What I've learned on this project and others is that usually there's not incompatible sort of goals. Everybody wants health. Everybody wants, I mean, there's certain things that we share as regardless of our organization, we're sort of humankind. I think where the challenges is that sometimes the tools and resources that you had before you weren't compatible to support the solution the solution before you. So what we really did was, you know, in our data collection process was have primary is the residents. What would make the residents contribute to their health, contribute to their safety, and really sort of we're very careful in honing in on that discussion. And then from there, knowing that whether it's Lutheran Social Services or the Westside Family Clinic, it was how do you then sort of use your systems to rally around what residents are saying is health, supports health for them. And that is a really hard discussion because that's where you start going like this. The intent is there, but the resources aren't before you. And so it was just a matter of slowing down, and it's just such a respectful, amazing group of people that were on this project. Dr. Pera really worked with her doctor team to do sort of coaching and education and really bringing them to the table to talk to residents and preparing them for those discussions so that as a group they could sort of rethink their strategies and tactics and tools. And then the same with Lutheran Social Services, who was providing the property management for the facility. This was the first time that Lutheran Social Services had really done a housing development project. And so some of the policies and practices that we're implementing that were around space use, gardening, it was sort of flipped. It was sort of top down. The residents were on the receiving end of the policies. So how do you turn that around and say if we want residents to really manage this, and you have to spend less staff time actually managing it if residents are handling it to a certain extent. How do you change, how you refine and have resident leadership really manage a distribution, a plot distribution process for the garden and let their cultural grow and let their ownership sort of lead, as opposed to sort of our mitigated sort of I use the word disrespectfully, I don't know how else to say it, sort of archaic way to make decisions for people who you're managing day to day. So I hope that answers the question a little bit. It's really just letting go of sort of your tools that you know and that you've become really comfortable with, and sort of giving a little space for you to listen very listen very closely to what people need and want and sort of reframe what you know, and then be willing to take that back to your organization and bring back something new.
Yeah, yeah, that's great.
I'll pick up on that theme. I mean, I think everybody at some level understands dollars and cents, and so a lot of times, you know, the expectation is they want $200 million worth of services. Well, we've only got $100 million. You know, it's been allocated for a specific purpose. So you got to kind of bring people back to, okay, this is what we have money to do. How do we want to best do it with the resources that we have? And everybody can kind of, you know, get around that concept. It's I think where you get in trouble is when you start getting into the very deep policy discussions about, you know, resources that may or may not exist. And two, I think that I guess regrets or things that I wish I would have done differently. I would have, I think, put our message out in the media a little bit more, so that you know, the neighborhoods and everybody is kind of gets the story from one source. You know, some of our issues were, you know, well, I heard from, you know, this neighborhood leader over here that you guys are going to do this, this, and this, and it's like, where'd you get that from? And I think if we had, you know, Twitter is now big and Facebook, like those weren't as big as they are now, and so I think that it's a lot easier to get your message out and kind of get the story out in a way that's much more effective.
That's great. Well, we could keep talking for a long time, and we have a lot more questions from folks that we didn't get to. This has been a fabulous conversation, but I'm going to have to start to wrap it up now. So I want to thank our audience for really some fabulous questions. I also really want to thank our speakers, Romi, JT, Maureen, and Mary. Thank you so much for joining us today, and what a pleasure to get to talk with all of you. I invite our audience to continue to share your questions and comments via Twitter using #NetworkCommons. We'd love to hear your suggestions for future events as well. Please fill out our survey, which you'll receive in your email shortly after the broadcast ends, because that's great feedback for us. And if you missed any portion of today's discussion, we're going to post highlights on the Build Healthy Places Network YouTube channel. If you're interested in learning more about the 4 projects that were discussed today, please visit the Community Close-Ups Case Study series at buildhealthyplaces.org. And we'll be rolling out 5 more case studies this year, so please continue to visit the site so you can check those out. Also check out our blog and check out Measure Up, our newly released web portal focused on metrics and measurement. And finally, if you're interested in learning more about cross-sector collaboration and would like to attend future events like this one, be sure to sign up for our newsletter on our website. We hope to see you on February 25th when we'll be discussing social impact investing for better health with 4 community investment experts. Thanks, everyone, and see you next time.
Thank you.
Bye-bye.